Next, from Chicago, we speak one-on-one with healthcare consultant Larry Boress, who tells us what he's hearing from business leaders about healthcare costs and his thoughts on how they can reduce their healthcare spending. This runs about 30 minutes. Larry Boress, you're the president of the Midwest Business Group on Health, and we appreciate you joining us on the Illinois Channel.
Thank you very much, Terry. It's a pleasure to join you today.
Let's start first. Just give us, if you would, while we want to get into a number of issues on healthcare and what's it mean to businesses around the state of Illinois as we talk about job creation. Give us an overview of what your organization does.
Sure, I'd be happy to. We were formed in 1980 as a nonprofit organization by 12 large Midwestern employers to focus on how they can get more value of their health benefit dollars, how they can work with their vendor partners, their health plans, to learn more about their data, and to try to influence the direction of healthcare, seeing that they pay for all the health services in this country. Employers pay over 70% in many locations of all healthcare, and nationally it's about 55, 60%. And we can actually drive the direction of healthcare, whether it's quality, safety, and we're hoping that engagement and cost containment will be part of that as well in the future.
And when you say you can drive it, what do you mean by that?
Well, if you look at the major changes in healthcare in this country over the last several years, it's really been the large employers who have focused on the variations in quality, the importance of safety in our hospitals, the importance of getting people engaged in their own healthcare. It's not been governmental legislation or direction. It's really been employers who have the opportunities as self-funded employers who can design their own benefits, decide what's important for their own unique workforces in their population, and put in new programs. And many of the employers who are leading healthcare in this country, who've sat on the Institute of Medicine committees and other national study groups, have come away from that experience saying, you know, we can't wait for government to do something. We've got to do it, and we've got purchasing dollars. I mean, my members, I've got over 110 companies who spend over $3 billion on healthcare to cover 2 million lives. That's a lot of chunk. That really pays for healthcare, and you can bring that to the table. And when you're meeting with the health systems or the health plans or others who are delivering the care to your workforces, you can set your expectations about quality and safety. And one of the challenges we have, one of the reasons our organization began, was employers never questioned or never got pushback from the vendors when they bought steel or rubber or plastic or glass. Their raw materials. They set metrics, they set standards. They only work with those vendors who delivered on the quality, on the time, on the cost. Healthcare, we don't have that. Employers have routinely paid the bill of whatever it came in. Somebody was in the hospital, there was a readmission, yeah, we paid that again. There was a mistake, we paid that again. There was multiple use of services, imaging or whatever, we would pay that. Every doctor was the same, every hospital was the same. We just assumed that we were getting quality, we assumed that the cost we were paying was right. But now we know it's not the case at all. The landscape of healthcare is strewn with inefficiency and overuse, underuse, and waste. And employers are able to find that. We're getting more data. And so our organization is about helping employers address this and, where appropriate, come together to use the leverage of combined purchasing dollars to make a difference in the care.
You know, it's interesting. I think you're right. Very few of us ever call up a doctor as we might call up a vendor if we're running a business and ask the vendor if he can't lower his price. We don't do that with a doctor. We don't say, hey, how come you're charging me $110 for a routine exam? Why don't you do it for $80 or something? Is in the larger sense, is that one of the primary things that you would do is to, you know, we're lacking the controls of the marketplace in healthcare. Is that part of what you're trying to reestablish, or do you achieve savings in a different way?
Well, I think there's a real recognition now that the quality varies tremendously in this country. Patient safety is a real concern. I mean, we run an activity called the Leapfrog Group on patient safety, and what it offers is we survey all the hospitals in Illinois about a variety of how they meet certain patient safety measures, and then we post it on a national website, www.leapfroggroup.org, so that any employer or any consumer, anyone can look and see the hospitals that they're going to, how they match up. And many times it's not the brand name hospitals that are the highest quality or highest safety. Sometimes it can be a small community hospital. Sometimes it's other facilities around who have really dedicated themselves to improving the quality and improving the safety. And so what we're all about is really telling employers, you got to be a responsible purchaser. You got to start looking at who you're buying from and how does it match up with your needs for your population. Not everybody is a big manufacturer who's got mostly males who average age of 57. You've got to say, what services do I need for my population? And then look at the services you're getting. How do the costs compare? How does the quality? Are they being proactive? One of the real challenges, Terry, that we've got as purchasers of healthcare is many times the vendors we buy from just accept the premium or benefit dollars, and they're not proactive, saying, you know, look, in your population we find you've got a number of high-risk young women for maternity care that you really should have this kind of program. Or as we look at your drug spend, we find that you could lower drugs by using either more generics or looking at the way you're offering co-pays and changing that. Those kinds of conversations are important to have for employers to be able to be productive, be competitive, and get more value from their benefit dollars.
So now, do you do any of those negotiations between a business and a healthcare provider, or are you providing consulting services?
Well, we're not so much a consultant. We only have 5 people in our organization, but we work with all the major consulting firms, and we work with the health plans. What we do is we have a separate entity called the Midwest Health Purchasers Foundation that does offer purchasing advice and direction. We do have an HMO buying group in Chicago for those companies that buy insured HMOs for Chicago. What we do is we facilitate that process. So we'll bring employers together to grouply negotiate and to evaluate health plans, but then every employer has its own rates as far as their demographics, benefit design, and experience. But we help them understand a process and an approach. We also have a group purchasing for pharmacy benefits that we do, and we help employers get low rates on a totally transparent pass-through program. But in general, what employers join our organization for is to understand how to buy health care, what questions should they be asking their brokers or their consultants, what can they learn from other employers. You know, what used to be called plagiarism is now best practices. You know, how can I learn from my colleagues in a similar industry, adapt that to my purchasing approach and in my population? So we're really more of a guide and a facilitator for advice with employers on healthcare benefit issues.
When you go in and they're looking obviously to be competitive, more competitive by lowering their healthcare costs, what kind of savings have you found can be achieved?
Well, you know, it starts at the top. Ideally, what we find is that wellness works. If you have a culture of health or an environment of health, you can actually reduce your costs. And why is that the case? I mean, years ago we used to think, well, a lunch and learn program is nice, or if I give people access to a WebMD, a website, that'll keep them healthy, or I'll waive co-pays nowadays, that'll keep them healthy. That's not the case. It starts out with what's going on in your operation. Is senior management committed to the health of your people? Because we'll spend $1 million to improve a locomotive, to make sure it runs fast, it stays on track, it's there on time. But will we spend similar money investing in a salesman who brings in $1 million a year, or our CFO who's negotiating contracts? If those people are unhealthy, or they're sick, or they've got a condition they're worried about for them and their family, they're not productive, so they're losing their ability to help that employer be successful. And so an investment in the human capital is just as important as investment in capital. And so it shouldn't be viewed as an expense. It has to be an investment. So by creating health programs that address the needs of your population, so if you have diabetics, addressing the diabetics. If you've got people with asthma, depression, obesity, fitness, you do that. And it goes even to the food and the fitness. What do you have in your vending machines? Do you have donut day, or do you bring in apples for everybody? Do you walk around the company? Does the CFO not smoke? What are you doing to express a direction of this company, of its philosophy about healthcare and about the importance of being healthy? And so,
let me, if I might.
Sure.
From a dollar standpoint, I mean,
right.
I would imagine, what they're looking to do, these businesses, to lower their costs. Can you, given the people you've worked with, what magnitude of savings have been achieved? Again,
it depends on the company. One thing we found in our research is that if you can reduce people's costs, you can reduce their risk, you reduce their costs. In general, we believe that 20% of our population costs 80% of our costs, and those are chronic disease people. What we find, though, is that's not a static group. All these so-called healthy people in our workforce are getting older, they're not eating right, they're not exercising, genetic factors come in, they have increasing risk, and pretty soon they start floating up to the top. To reduce costs as an employer, you've got to keep people from getting worse. You've got to keep the healthy people healthy. You've got to have 75% of your people essentially healthy and keep that 15 to 20% of chronic disease group from getting worse. For example, we've got a program to help diabetic employees and their dependents. And what we find is that diabetics, if they understand their condition, stay on their medications, know how to monitor themselves, doctors can prevent losing their limbs, going blind, going on dialysis, having hospitalizations. So for example, the program that we have, we work with the Illinois Pharmacists Association, and what we do is employers agree to waive or reduce co-pays for diabetics who agree to see a specially trained pharmacist coach on a regular basis. If they do that, we find employers can save up to $3,000 per year on diabetics who are more compliant on their drugs and see their conditions. A key part, Terry, that we don't understand or that we've learned is that people see their doctors maybe once or twice a year for 15, 20 minutes. People see their employer 1,000 to 2,000 hours at the work site. So there's a tremendous opportunity for employers to educate people, help them identify problems, and help them work on that. Then you talk about benefit design, offering genetic drugs, offering preventive services, giving people tools that they can, again, help manage. That's how you lower your cost in the long run.
Are the savings, while they're going to vary, are the savings, and I guess, I mean, why I'm hitting on this is it seems like if I'm a businessman listening to this, I might be interested, but if it's not going to save me money, then what's the point, I guess? So are the savings significant, and how long would they take to actualize?
Well, the savings can be significant, but clearly when you're trying to change healthcare, you're making an investment in long term. A lot of employers may think, well, I have a transit workforce, I'll keep them maybe 2 or 3 years, why invest in wellness? But in fact, there's things you could do. For example, the diabetes program we've got, you can get savings within 12 months. If you can keep people out of the hospital, because our greatest cost is hospital emergency room visits and people being in hospital. If you can stop that from happening, you can reduce your costs in a very short period of time.
Let me ask you on the charges there. Let's say you keep your employees out of the hospital. Is healthcare priced the way automobile insurance is priced? If I have an accident, my insurance will go up. It seems to me, and I may be erroneous, that my healthcare cost is going to be stagnant whether I use it or not, or it's going to be stagnant or going up whether I use it or not. So I don't know if I keep my people out of the hospital, am I actually going to see the savings if I'm running a widget factory?
Well, most employers who are buying insured products, and that's probably 70% of our entire business community, are tending to buy products and tended to be where we'd call community rated, where they're put in a large pool of other employers and that plan looks at them. But what we find is more and more, if you can keep your individual costs down, many times you can then work with your health plan, work with the vendors, and try to develop a benefit design and premium that fits what you're doing. And it's important to try to find the services that are being offered. A lot of employers pay premium for a variety of services that the health plan has that they never take advantage of. Worksite programs, health fairs, call lines, a variety of materials and resources that can be used. So it's not that you don't have any choice at all. In fact, the plans nowadays are becoming more aware that in fact you can reduce the cost and utilization and risk of a workforce. And particularly if you're self-funded, it makes a huge difference because you've got most of that risk. But even as an insured employer, if you keep your people healthy, you can keep your premium costs much lower than a general trend.
When you work with businesses, how small do you go when you work with firms?
Well, our organization tends to have only self-funded firms, so our people average 3,000 lives. Our smallest employers probably, though, got 86 employees. Many of the things we talk about, again, deals with your ability to design and manage a benefit. If you're self-funded, self-insured, you can do that. As a small employer, there's still things that you can do because you can bring in services and programs that are available at little or no cost from groups like the American Heart Association, the Cancer Society, the Respiratory Health Association, the local health departments, even the local community hospitals and medical groups many times will offer free or low-cost programs that can keep your people healthy and keep them on the job, which is what you want.
Tell us because a lot of people are not self-insured, how does that work?
The main difference between being fully insured and self-insured is that a fully insured company essentially gives a bag of money to a health plan, and that's the premium. And so you're saying to the health plan, you take all the risk for my population, and I'm going to pay you this amount, or the plan tells me how much to pay. A self-insured employer essentially keeps that bag of money and says, I'm going to be responsible for the risk of my employees. I'm going to offer programs that meet their needs, and I'm going to pay you as a health plan an administrative service amount or ASO fee, so I will rent your network and I'll rent certain services from you, but in general, I'm going to manage the care of my employees. What we find is that employers, again, who are very serious about creating a culture of health and focusing on the health of their people, can reduce their overall benefit costs because they've helped keep their people healthy. They design programs just for their population. They design drug programs and management just for their population. So they've got a lot more control. We find now more and more employers who are around 200 lives are beginning to become self-funded as well because they feel there's real value there. Because you can buy what they call stop-loss insurance, which will protect you from too much exposure.
That's an interesting, I mean, I've heard it in the stock market, but I've never heard it in an insurance capacity. Let's follow up on that one, and I had some other questions, but on the stop-loss, how does that work? And again, does it matter on what size of a business?
No, it doesn't matter on what size. It's strictly how much risk you're willing to take. Essentially, you're saying, I'm willing to spend a certain amount or to be at risk for a certain amount, and maybe it's a $75,000 or $100,000 for any individual employee situation. If, in fact, they have a very neonatal intensive care problem or a major accident or major cancer, and all of a sudden it costs much more than $100,000, insurance will cover that.
So you buy is it a rider that would be for
no,
catastrophic?
It's a separate stop-loss insurance that you would
separate
purchase.
Policy that
That's
kick
correct.
in for, I guess, above a dollar amount.
Right, whatever dollar threshold you want to set that for.
Do you advise people, and I don't know if you get into this, but I mean, do you advise people as far as using health savings accounts?
Absolutely. I think for many smaller employers, it's a much more cost-effective benefit to have. Where you remember, a health savings account is just a bank account. Some employers are just using it as a retirement savings accounts, actually, because the money you put in is tax-free, the money that it earns is tax-free, and the money and when you pull it out, it's tax-free money. But it's only used for health care issues, can't use it for anything else. But the value of a health savings account is, of course, attached to a high deductible plan, and it could be a PPO plan.
I was going to say, why don't we, basically a health savings account, I would say it's more like an IRA. People might be familiar with that kind of a concept, where you put money aside for your health care,
right.
But you dramatically raise the
there's a deductible.
The deductible,
That's right.
The threshold, in other words, of
right.
your coverage. So instead of having a $1,000 or $500 deductible where you pay 100% of the first cost, you might raise that to, what, $5,000
Well,
perhaps?
it could be as much as $1,000 or $1,500 an individual, or $3,000 or $5,000 a family. Again, it depends on what the employer wants to do, and there's a multitude of options out there nowadays. Many of the carriers offer that for small employers.
And just to finish the thought, so let's say they raise it to $5,000, the business might say to their employee, you know, we got to pick up the first $5,000, but I'll have the business, if you really, you know, need to pick up after $2,500, and what you're setting aside from your paycheck is going to cover the first $2,500.
Well, you have the option. I mean, that's the value of this kind of approach.
The idea that money accumulates over time,
right.
so that if you're healthy, after 3, 4, 5 years of being relatively healthy, except for taking the kid to the doctor for a sniffles or something, you might have $10,000 as a worker saved up in that.
Well,
account.
what they find is that nationally, again, on a general average, they find people spend about $650 a year on health care, generally.
The average person.
The average person. Now, what we find is if you don't spend a lot on health care one year, you tend to spend a lot another.
Right.
But the health savings account is, the theory behind it is that, let's say you have a $1,000 deductible, and the most effective employers who offer health savings accounts do contribute something toward it. It could be 50% or it could be nothing. It's up to the employer. But it lets, from an employee perspective, if my employer is putting in, let's say, $1,500, and then I put in $1,500, so I reach that $3,000 deductible. If I'm able to manage my cost and I only spend $650, then I've only been spending up to what the employer's put in, and then after a year, that money rolls over, and an employer puts in another $1,500. So if I can keep my costs down as an individual employee or consumer, I can just use what the money is that the employer has put in, and then as money rolls over each year, I accumulate amount. And then if I leave the employer, that money goes with me. It's not tied to employment, which is the other beauty part of that.
I don't want to make it all about health savings accounts, but it might be something that people want to look into
Absolutely.
if they haven't. Those that have used it, your experience, have they been happy with the cost savings on a health savings account? Have they been happy with the health care that they have been able to provide to their workers?
Well, again, the health care is the same. Whether you have a PPO, a preferred provider organization, or you have a health savings account that's linked to a PPO, the network and the docs would be the same.
Right.
So that's really not.
It's just how you pay for the first dollars, I guess.
Right, and I would say most employers have been very happy with it because it allows you to really budget, because it says you are only going to put in a certain amount for your employees each year. That's it. That's the extent of it. From an employee perspective, many of the, for example, large and consulting firms, they've moved all their people into health savings accounts. It is a way to really reduce costs, and again, because the person's often taking out of their own pocket to pay bills, it forces them to be much more of an effective consumer, ask questions. Do I really need this procedure? If I twist my ankle, do I really need to go to the emergency department?
It brings the marketplace, as we started off, into the healthcare buying decision. I mean, no one's going to be negotiating the price of an ambulance, right, if you're having a heart attack, but if you're just feeling a little stuffy, you may decide you don't want to spend $50 or $100 to go in and see your doctor. You'll just wait the next day and see if you feel better, or take a couple aspirin.
Exactly. What we find, it does force people to be informed consumers. It's what we call behavioral economics. If people are paying for something, they pay more attention to it, whether it's their car or whether it's their family's health. And so it really does drive people in the right directions. One of the problems we've had as employer purchasers is we've developed a philosophy of entitlement in our populations. People have said, well, it costs me $10 to go to the emergency room, $5 for a drug. If I have a baby, it's $20. They don't see the actual cost of care under a health savings account, and even other kinds of programs now. Employers are saying, this is the actual cost. And when people have a choice, do I get a generic or a brand drug for my prescription, and they can see that the generic is $5 and the brand drug could be $150, they make that decision knowing that the drugs are exactly the same, but now they have the choice.
Let me ask you might be an unfair question. I mean, obviously the state of Illinois is basically broke. One of its largest costs is health care.
Right.
Could any of this approach that you're dealing with in the public or private sector, when you're dealing with businesses, could that be applied to government?
Oh, absolutely. State of Illinois is a member of our organization, and is the City of Chicago, Village of Oak Lawn, and a number of other groups. The process and the approach is the same. Some issues that though come up for governmental employers or any employer who's unionized is what's in the union contract. Many times you don't have the flexibility, but a lot of these strategies are the state's already looking into, or that it's available to take advantage of, because it's all there for you.
And let's talk about pharmaceuticals. You touched on it vaguely, but a lot of people are using, obviously, pills for one thing or another. Could the average person who's listening to this, as well as the businessman, should they be looking at the generic alternatives, and how do they know if there is an adequate generic available for whatever pill they're taking?
Well, first of all, people need to understand, generic is not low quality. Generic is...
It's not like it's some guy knocking them out in an alleyway.
No, essentially a generic is the brand drug that's lost its patent. And so now anyone can produce that drug. There's not that protected patent that the pharmaceutical manufacturer that did the research and developed this. Now you have a multitude of options. So for example, Lipitor, which is the highest cost drug for most employers, it's used for a variety of conditions, diabetes or for other kinds of conditions. That costs perhaps $150 as a copay for some people, and in some cases it's not even covered. In 2011, that's going to be generic. You can probably be able to get that for $5. A number of drugs are like, so it's the same drug, it's just got a different name, and it's of equal quality. So now, there are generics that don't, that people have problems.
Well, how do people even find out, though?
You ask your doctor. I mean, that's number one. Or you ask your pharmacist. I mean, Illinois has a law that says when the physician's prescribing, they can indicate that the pharmacist may substitute or may not substitute. In the vast majority of cases, the physician allows you to substitute if there is a generic. Not all brand name drugs have generics. But when you go to the pharmacy and you ask them, is there a lower cost drug or generic I could have, many times the pharmacist will be able to tell you that. Now, some generics are encased in a different kind of coating or thing, so some people do have reactions differently for the generic than the brand, but there are multiple generics. Myself, I'm on a high blood pressure medication. I found that there was one generic that worked perfect for me, and there was another for supposedly the same brand that I got reactions to. But once we found that between my physician and pharmacist, I have no problems at all. It reduces my costs dramatically and my out-of-pocket cost, and for the employer as well. So people should always ask about generics, and then they should also start comparing pharmacies. We find that retail pharmacies in the same community within the same 6-block area will have dramatically different costs for the same drug. So it really helps
Just
to
like
shop
shopping
around.
for our car. I mean,
Exactly.
you don't think of healthcare again. So it does seem like so many of what you're talking about is this thing about bringing the marketplace cost comparisons in, as well as working to keep yourself healthy so that you're not utilizing healthcare costs. Before we close out, there's just a lot of confusion about where we stand relative to the Obama healthcare. How is that manifesting itself? You're dealing with these big business people, and obviously you're talking about healthcare. Are they perplexed? Are we going to be in a situation where people are dumping their private health care and going to the Obamacare? I mean, of course, we don't even know as we say this if the Republicans are going to try to eventually take that back off the books. But this must be stirring just a great deal of confusion within the business community as they try to address the health concerns of their employees.
Yeah, I think the amount of uncertainty among large and small employers is there. I mean, the regulations for many of the provisions have not been written yet. We're in the middle or toward the end of open enrollment for many employers, and still there could be changes in 2011. A lot of them are trying modeling at their handle around it. I think there's just a lot of uncertainty. Most of our members, though, have maintained a course. They're still going to offer benefits because, again, they see that link between health and productivity. Employers don't offer benefits because they're altruistic. They offer to recruit and retain employees and to keep people healthy. And that goes for small employers as well. If you're going to keep your people, your high-quality people, your great salespeople, you've got to offer health benefits. Now, the health reform is going to offer benefits, and it's going to be issues. Clearly, the vast majority of the reform ended up being insurance reform, which is not where we had wanted it to go. But Republicans are not going to repeal the insurance reforms, the protections on people with the pre-existing conditions, the extension of the coverage, a variety of those things. But there's been a lot of good parts in health reform that haven't been identified. Changing the way we're paying for health care, moving from a fee-for-service to perhaps global or bundled payment, creating medical homes or more coordinating care, offering comparisons of effectiveness of drugs and devices. A lot of studies that are going to have to be done. But right now, for employers, they really need to focus on what they've got. The new health insurance exchanges that will help most small employers. The law created these health insurance exchanges. Well, it created the concept. They're to be implemented in 2014. Every state is to develop its own exchange, and the federal government is giving the state money. So Governor Quinn has created an Illinois Health Reform Implementation Council, and they're looking at this issue of health insurance exchanges, what it should be, how it should be structured, what the access.
What is the concept of
Essentially, it's a marketplace. You'll go online, and you'd say, as an individual or as an employer, I'm looking for health care. And you'd say, what kind of care, what kind of benefits are you looking for? And there'd be a multitude of health plans on the website, like a buying site, that would offer benefits, show pricing, show benefits, and then you would ideally pick the one that works best for you. The idea being that it would be hopefully more affordable for individuals as well as small employers. So many small employers, we think, because the penalty is so low not to offer insurance compared to just letting your people go on the exchange, that many employers may decide to let people go on the exchange. and then individuals will essentially have a marketplace of insurance products to purchase. What's key that we're going to try to get involved in, and I think other businesses, is that to make sure the exchange offers a multitude of products. They're quality products. There's a lot of transparency in cost and service and performance, so you know what you're buying. Because unfortunately, over the care, there's always going to be poor quality products, and you want to make sure your people aren't exposed to that.
Well, Larry Boress, we appreciate you taking the time to talk with us, and maybe we can visit with you again as the time goes on.
Be my pleasure, Terry. Thank you very much.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.